All right, welcome back to our next session, Covidism, a disease with no cure. I'm told Troy Lanigan came up with that excellent title. Let me see if I can do a bridge from the last segment because, as you know, I'm Danielle Smith, radio host with 770 CHQR in Calgary. I may have to disagree slightly with my former boss, Peter Menzies, who was my boss when I was at the Calgary Herald. The problem with Twitter and Facebook and Google is they're not just private companies. Somebody asked the question about Hunter Biden and the laptop. When Twitter made the decision not to allow the New York Post story to be shared, it had a chilling effect on all of the media. Because in the media, we are governed by the Broadcast Standards Council. And if Jack Dorsey determines that something is so unreliable that he can't even put it on Twitter, then what that does is it means that anybody in the mainstream media who can't independently verify it won't run with the story. Now, why is that a bridge to this segment? The reason it's a bridge to this segment is because I think it was Sundar Pichai from Google who said that he would not allow for anything that contradicted Dr. Anthony Fauci to appear on social media platforms. So guess what that means? So that if you end up with a group of doctors who are trying to put an alternative opinion out there about the relative concern and about different levels of infection and bad outcomes at different levels of population, or trying to put out different treatments, if you have the YouTube and Twitter and Facebook decide that they don't want you to see it, the mainstream media won't cover it either. So I think that I'm far more concerned about the level of control that people like Jack Dorsey, who looks like he has gone all Howard Hughes on us, the kind of control he is able to influence on the media at large. So I'd put that for you out there to consider, because I think that's going to be relevant to our next discussion, because once again, we'll try to start off with the same set of facts. On this topic, I don't know if we have the same set of facts. So I'll see if I can do my best, and then I know that my guests on this panel will either agree with me or they'll vehemently contradict me. We've got Dr. David Zitner, who's retired from as a professor from the Dalhousie University, Faculty of Medicine and Computer Science. We've got John Carpay, who is the Executive Director of the Justice Centre for Constitutional Freedoms. And we've got Jasmine Moulton, who is the Canadian Taxpayers Federation Communications Director. But let me tell you how I come to this, because as an opinion commentator, I understand, and you should understand, that I come to it with a bias, because I do a lot of segments on this issue. So I want you to know what my sort of pre-existing views are on this issue. Number one is that there really isn't one single government response to COVID. You've got at one extreme end on the freedom scale, I would say Sweden is probably at the most extreme end, followed by Florida and South Dakota. They've taken the view that they want people to be responsible, but they do not want to do lockdowns. On the other end of extreme, you've got Peru and Italy and New York, who have imposed extraordinary lockdowns. I would even maybe talk about Australia and Danny Daniels, who sends police officers into people's homes if they talk about organizing a lockdown protest, and takes them away and arrests them, or arrest them for not wearing a mask. So you've got these two extremes. What I find interesting about all of the jurisdictions that I mentioned is that whether it's lockdown or whether it's no lockdown, the virus will do what it wants to do. Politicians, I know maybe it doesn't need to be said, or maybe it does. Politicians can't regulate viruses, so that would be number one. Number two, and I'm quoting Dr. Dina Hinshaw, just so I don't get in trouble, she has given a press conference recently saying that the risk to those under the age of 40 is vanishingly small. That was the term she used. The risk to those age 40 to 70 is about the same as influenza, and the risk of those over 70 or with one or more comorbidities is dramatically more dangerous than flu. So I think it's important to have that information as we start talking through the different options. Number three, the pending vaccines have a lot of problems. If you've been following along, looking at what Pfizer and Moderna and AstraZeneca and others are doing, we're seeing instances where they're having adverse effects that's going to delay us getting to a vaccine. But more importantly, all of them require the vaccine to be cooled to a level of minus 80 degrees Celsius. So there's going to be extraordinary challenges in getting this rolled out. They're going to need to use special containers to be able to get it out to the different jurisdictions. So if you're talking about 5 billion doses and you're going to need 2 of them with this particular anomaly, this is going to delay a vaccine. So for those of you thinking, well, let's just lock down until we have a vaccine, we're talking potentially years before we get to a point where you get to herd immunity with the level of vaccines. And number 5, politicians, frankly, don't know what to do. They're terrified because people are terrified. And when politicians are terrified, they sometimes do dumb things that won't work. And I put Doug Ford's actions into that category, and he's now realizing that because they're coming up to the end of their 28-day lockdown on restaurants, and they're realizing that they haven't done much to change the rate at which it transmits. They've got the same roughly hospitalization rates as when they began, and they've got the same roughly ICU rates as when they began. So I put all of that out there because I want you to understand. I talk about this a lot. I don't want you to be shocked by anything that I've said or any of my pre-existing attitudes towards this, but hopefully you'll be able to challenge us along the way. And the first challenger up is going to be Dr. David Zitmer. He's going to either affirm some of what I've said or told me why I'm completely off the rails, and then we will get into the legal aspects, and then we'll get into the economic aspects. But let's start it off with Dr. Zitmer. Dr. Zitmer, thanks so much for being with us on this. Why don't you tell us what pre-existing sort of attitudes you bring to it as well?
It's my pleasure. I wish you were totally off the rails, but your comment that people don't know what to do is pretty accurate. And I'm glad to be on this panel with John and Jasmine, because the structural problems that prevent policymakers and even clinicians, I know it's bad to say there are good people on both sides, but almost every argument related to COVID, you can find good, reputable clinicians and epidemiologists to support a position. The reason I'm happy to be on with a legal person and a taxpayer federation person is that the reason we don't know is that we don't track the fate of people by various treatments. So when you do an intervention in healthcare, you hope that it helps the problem that you're dealing with, but you also hope that it doesn't cause other problems. With regard to COVID, the lockdown, as people have widely mentioned, causes serious problems in terms of commerce, in terms of mental health, in terms of isolation. But unless we track the fate of people who have particular characteristics to learn who's at risk, who isn't, and what happens when they're treated, we can't get the answers easily. The reason it's important for the Taxpayers Federation is that in healthcare, we spend tons of money and we don't know what we get because we don't track the overall costs and benefits. And the legal issue is when somebody has a test or a treatment, what is the limits of a government or non-governmental organization's ability to anonymously track the fate of the person who had the test or treatment? My bias is that we need to have localized solutions that are pertinent to the community. So in Halifax, like New Zealand, where there are large areas that aren't infected, we don't have to be as cautious. In areas where it's widespread, people should be more conscientious about wearing masks. So that's my bias.
Dr. Zitmer, let's just talk a little bit more about, I want to just try to get to some of the bottom of some of the medical issues before we go into the legal issues. In your opinion, is it possible for a nation like Canada or a jurisdiction like Ontario or a city like Toronto to get to 0 cases before they allow for an ease in restrictions? I think that there's this notion that, well, Taiwan did it and New Zealand did it once. Maybe we can do it too. Is 0 cases the right target?
No, 0 cases is clearly impossible. I don't think there'd be much disagreement about that, especially with a virus that might mutate and where you have visitors and people bringing infections in.
Well, I don't want to
But if you
presume.
have- but
Can
if-
I just can I
if
get
you-
you to comment on
Sure.
that a little bit more, Dr. Zitmer? Because I guess I'm hearing a lot of people say they think it is possible, and that not only is it possible, but we shouldn't ease restrictions until we've met zero for 2 weeks straight. And so I think that there is this conception that it is possible. So you may tell us a little bit more about why it would be impossible.
Well, first of all, you have to have very widespread surveillance to even know when you have zero incidents in a community. So unless you test everybody on a regular basis, you won't be able to even proclaim that you've reached the goal of zero cases. The other issue is that as long as you have an open economy and a place where people come and visit, somebody may bring the disease in. And if you consider testing people before they come, some people may be in the pre-infective stage when you test them, and they may not be detectable, but they may come in and get it. So I think this isn't going to be like smallpox, where we actually did totally wipe it out.
Tell me.
And I think with regard to a vaccine, the history with flu vaccine is that people need a yearly immunization. They think that's a whole separate issue that we probably shouldn't raise in this panel.
Well, we can talk about that if you have more you want to say on it. But let me ask you about data and what we should be looking at. I think we need to begin by looking at the Imperial College projections, because this got everybody set to thinking. I know our own premier was told that 30,000 Albertans were likely to die if he did nothing. I think he was told there might be 800,000 people in hospital. These are just bonkers, these kinds of numbers. But you know what's interesting to me is everyone is acting as if that still might be true.
Yeah.
We're taking the same measures as we did in March and April when we knew nothing as what we do now, even though we've seen the example of Sweden. I mean, if Sweden's the worst case scenario because they didn't do any of the same restrictions as anyone else, why isn't that influencing how our politicians and health professionals are talking about this virus? Can you comment on that?
I think they've confused an average with learning about who the particular groups are who are at risk. So there's some people who are vulnerable, even younger people who are more vulnerable than others. If we identify the people who are most vulnerable, the characteristics of people most likely to get this disease and suffer from it, then we're able to put in interventions for that particular group and let everyone else go on their merry way. But as long as we don't have the tools and technology that Amazon and Costco and any modern retail industry has to learn about the characteristics of people who get this or that disease, we're not able to have focused interventions.
The World Health Organization now has even said, don't do blanket lockdowns.
Right.
And so they've said the only reason to do lockdown is if you're going to get to the limit of your hospital and ICU capacity. I find it interesting. Now politicians keep on telling us, oh my gosh, we're almost at the limit of our hospital and ICU capacity. But I must tell you that I've looked at the numbers in Ontario just yesterday. 325 people in hospital because of COVID. We're at about 170 in Alberta. I think it's about 85 people in ICU. I think we're about 30 in Alberta. If that's enough to collapse a funded healthcare system that takes basically 50% of all the tax dollars that we give to it, like, what does that say about our health system? Are they just using that as an excuse for lockdowns, or are we genuinely reaching the limit of the capacity of our healthcare system with those kind of numbers?
For Jasmine especially, the bad news is that we've always been near the limits. So if you read the emergency department medical journals, they claim that often the emergency departments are at or near capacity, that the hospitals are at or near capacity, even before we had COVID. And the result is that people are dying. is in the published literature. So suddenly we've said we're at capacity, but we were at capacity before. And people could identify folk who were dying. We have some references to that in the paper we did for the Macdonald-Laurier Institute. So this isn't a contentious idea, but many jurisdictions in Canada have been at their capacity limits. At the same time as we spend money on a lot of things that possibly produce more harm than good, and that might be superfluous to overall health. But as long as we don't measure what happens to people when they get tests or treatments, we don't know. By the way, in 1994, the federal provincial territorial deputy ministers unanimously and enthusiastically endorsed the idea that they would report on a regular basis on access to care and the results of care. But they still haven't done it. I thought that would happen when they said they would do it, but I was even more naive then than I am now. I'm still pretty naive.
Well, I guess it's almost like a Monty Python sketch, I have to tell you, Dr. Zitmer. It's, the hospitals operate great. We've got wonderful administration. We've hired all our doctors and all of our nurses, but we don't want to treat any patients because we might get overwhelmed. I don't know that that's going to be a sustainable model of just preventing people from getting sick. And so I'm wondering if you can give us some context. What should we be judging? What is a sustainable model? Where do we need to go in a change in health policy?
Well, what's happened is that we've had a lot of excess capacity as they've shut down the emergency and admissions. So people are hanging around not doing very much, which should bother everyone, especially those people on the waiting lists. And the emergency room doctors say that when the emergency department's above 85 or 90% capacity, you get an increase in unnecessary deaths. The problem, of course, is that appearing to save money, many hospital administrators get annoyed when some people in emergency departments have time to have a coffee. They think they should be running around all the time, and they mistake activity for results. So I think the emergency department would be a good place to look to see whether the system's over capacity or not. I think we need to track those health services that create more harm than good. And I can think, for example, in mental health, where a large number of the interventions may produce more harm than good, but still cost a lot of money.
All right.
But unless you measure results, there's no way of knowing. There's some studies in psychiatric hospitals where people who are on waiting lists, when they waited 3 or 6 or 9 months and got called, now it's time to come in and be seen to get an intervention. They said, I don't even remember making an appointment because they're better. There are things in orthopedic surgery where people spontaneously recover. But we need to learn the characteristics of those people so we can spend the money properly.
All right, Dr. Zitmer, I thought it was important for us to kind of set some of the medical issues on the table. Now I'm going to go to the legal side with John Carpay with the Justice Center for Constitutional Freedom. He and I have talked a lot about these issues. I don't know if there's any additional kind of medical points you want to put on the table. I know that you've raised some of these as well in the kind of lawsuits and challenges that you've brought forward. Is there anything else that you think is important to put into context for this?
Well, I don't have more, what I would say medical facts that I think need to be put on the table. I think that's been canvassed quite thoroughly. But from a charter standpoint, the onus is on the government to justify the violations. We're into our 8th month now of having our freedoms to move, travel, associate, assemble, worship. All of these fundamental freedoms are being violated. And a lot of people lose sight of the fact it's not up to the citizens to explain why this is wrong, why this should not be the case. The onus is on the government to justify these violations. And then, of course, in that justification process, you do get into medical issues like how many people are dying, and are these cases, cases of sick people, or are they, perfectly healthy people that we have a high false positive rate? So we do get into the medical issues as part of the legal justification process.
Okay, let's talk a little bit about that, because I asked the doc if 0 cases was achievable, and he said no. But I think that there's this notion that 0 deaths is what we should be striving for, and 1 death is too many. And as long as there is 1 death, that justifies all of the government actions that we've seen so far. How would you respond to that from a legal perspective?
Well, under the Charter, there's the Oakes test, which is fairly complex and lengthy. I won't go through the different components, but one element in the Oakes test is that the onus is on the government to show that the Charter violating laws and policies are doing more good than harm. So there's a weighing of harms and benefits. And when you look at the costs of the lockdown in terms of increases in drug overdoses, apparent increases in suicides, the data is not all fully in the door yet, 305 million people unemployed in the third world, which of course technically doesn't apply to our Canadian Charter analysis. But you look at all of these harms from the lockdowns, cancer, increases in cancer deaths because people did not get their cancer diagnosis. So this even one life type of an argument you have to look at the big picture, because the onus is on the government to show that the Charter violating measures, the lockdown measures, are actually saving more people than they're killing.
So here's, I guess, the question is that how do we resolve this? Because it does strike me that these provisions have come into effect. I know that your organization, and there's a few others, that issue press releases and write letters and issue stern warnings, but it can take a long time to get any of this litigated if we were to resort to the Charter. So it seems like we're in this middle of, they're violating our Charter rights. They probably wouldn't have it justified, but how does it stop? Is there going to be a legal process for it to stop, or how do you see governments rolling back on some of these things, if not for a legal response?
I think court action, unfortunately, would take a long time. The positive thing about it is it would force the government to answer questions. I mean, I've written to all of the premiers and chief medical officers back in April and said, have you considered what we're going to see with increases in suicides, drug overdoses, family violence, cancer deaths because there's no diagnosis, deaths from canceled surgeries, et cetera, et cetera. Questions not answered. And 2 months ago, I wrote about the canceled surgeries. How many were for heart surgery versus hip surgery versus whatever, and how many people have died because the surgeries were canceled? How many have suffered permanent damage to health? No answers to the questions. So the court action, which I think will come, it's a matter of when, not if, but the court action is going to force the government to answer those questions because the onus is on the government to justify the measures.
I want to ask you about the most recent changes in Alberta, and I'm coming to the conclusion that you almost have to pick your poison, that government is going to do something, and so you want them to do the least harm, and you want to them to do the right thing. So for those of you who didn't see what Premier Jason Kenney announced yesterday, he's coming down very hard on, he calls them social gatherings, so any kind of private gathering of 15 people where you will intermingle. So you can't have a reception before an event, can't have a reception before or after a wedding or a funeral, can't have a reception before or after church. But he says that you can do structured events. So he's taken an opposite approach, which I find kind of interesting. He's basically telling people, if you want to be safe, go out to a restaurant, go out to a bar, just don't have people over to your house, which is kind of the reverse of what we're seeing in Ontario. So I'm a little annoyed because I don't know what the legal right is for government to send a police officer to knock on my door because my neighbor snitched on me saying that they think there's 16 people in my home. So we'll deal with this in two different realms, because I think in some ways it's probably the least intrusive way of trying to address this problem, causing the least amount of harm to the general economy. And we'll talk about economy in a second. But can they do that? Like if an officer shows up at my door, can they come in? Do they need a warrant? What am I supposed to say?
Well, if if police want to come into a house because there is somebody that's dealing in drugs or producing child pornography or committing some sort of a crime, the police need to get a warrant from a judge based on affidavit evidence. And in my view, the threshold should be no lower for police wanting to barge into a home based on some complaint. But I think the deeper issue is that we're still operating on the fear-mongering that took place in March and April when, and referring again to Alberta, Dina Hinshaw and Jason Kenney said that even with lockdown measures in place, as many as 32,000 Albertans would die. This is still on the Alberta Health website. It's the April 8th modeling. And we're now 8 months later. We have the facts. We know that the death stats do not put COVID-19 into the range of a real pandemic like the 1918 Spanish flu, the 1957 Asian flu, the 1968 Hong Kong flu. We know that this was fear-mongering in April, and sadly we still have public policy violating our charter freedoms based on information that we know to be false.
Okay, so what you've told me is they do need a warrant. So that I will know if somebody comes to my door. But
ask for a warrant.
Let's talk then about some of the more extreme measures we've seen elsewhere. Because if I understand Quebec's laws, you can't even have one person over to your house. Does government have the ability to tell you that?
What makes it worse? Sorry to be doom and gloom for a moment, but the courts they're starting to reopen, but the courts really denied access to justice for months on end. They shut down. They also bought into all the fear-mongering that we should all be very afraid of this virus. The violations of our charter freedoms are clear and blatant, and the challenges are that there aren't that many legal resources to find the right plaintiff and the right fact scenario, or a willing plaintiff. I mean, a lot of people just don't want to be the one that's going to take something into court. And then you've got a legal process that will drag on for years, and you've got courts that are still partially shut down. But the violations of charter freedoms are blatant. When government tells you can't have, you have to have 0 people over to your house, or 1 person, or 15 people, regardless of how bad it is, that violates your freedom of association.
I agree. Okay, so let me just, I always like people to understand how extreme it could get, because my view, and I tell my audience this a lot, is if you're not pushing for more freedom, there's going to be someone on the other side pushing for more control and more lockdown and more restrictions. Is it possible in Canada that we would go the route of what we've seen in Australia, in Victoria Province with Danny Daniels, where you're literally seeing teams of police officers arresting and taking down people for not wearing a mask and hauling them off to prison? Also busting down their door because they posted about a lockdown event on their Facebook page. I've seen 2 instances like that. Could that happen here? Is there anything that would stop that from happening other than just the restraint of politicians?
I hate to say it, I think that yes, that could happen in Canada. We have a federal government which speaks quite openly and quite publicly about how government should be running the internet to stop misinformation and disinformation, which is horribly creepy because when it comes to something as important as COVID and the lockdowns and our fundamental charter freedoms, this is where we need robust debate more than ever before, especially when the experts or so-called experts are not even on the same page. You've got experts, as the good doctor said a few minutes ago, we've got experts on both sides of various issues. And so, but yes, if we are not vigilant and if we don't push back, we could very easily, very quickly get into a complete police state where the governments are, knocking down doors and forcing people to, arresting people for not wearing a mask in public while walking on the street all by themselves outdoors.
Do you think we're at a breaking point? Do you think that anywhere you're seeing because here's what I would say is the interesting thing about Sweden and why it worked is that people are able to assess their own level of risk. I feel like that was happening in March and April anyway. The people were saying, you know what, too risky, I'm staying at home. People now know more about this virus as well, and if what their own perception of their risk is mismatches what officials are telling us, what wins? Like, are we at a point where we're going to be seeing a turning point here?
Well, I hope so, because the onus is on the government to have the science to back up the charter violating measures and to justify them. So I think the government in court would have a hard time arguing against an approach as advocated by thousands and thousands of doctors and public health scientists and infectious disease specialists all over the world in the Great Barrington Declaration from roughly a month ago, where they said we need to have targeted, focused protection on the vulnerable people, and the 90% of the population that's not vulnerable, that's not threatened by the virus, should be able to get on with our lives and produce the wealth that is needed to have a good medical system, amongst other things. So the onus is on the government to explain in court, why are you not pursuing the approach of focused protection of the vulnerable? Why are you locking down millions of healthy people? Which, by the way, it's the first time in human history that any government has tried this. It's an experiment.
All right, so a couple things. Focused protection, that's from the Barrington Declaration. In Ottawa, they're trying to move to something called coexistence with care or coexistence with caution. And then Kenny, he's basically saying we're safer in a structured environment. So those are sort of three different ways in which the politicians are moving. Let's go to Jasmine now, because I'll mention this. Jasmine Moulton, of course, is the Canadian Taxpayers Federation Communications Director. Jasmine, what does it matter? We can just keep on printing money. We can keep on running debt. We can give people a universal basic income. If we run out of money in the healthcare system, what the heck? We control the Bank of Canada. We can just print more. Like, there's no reason why we have to get our economy going again, is there?
Well, we've been told for a long time now that there's no such thing as a free lunch, and we should be very skeptical when people say that they're offering free money, that there will be no sort of repercussions in the future. So the issue with, at the federal level, printing money, so to speak, is that there is a real risk that in the future we'll experience inflation, which is kind of like a quiet tax that makes all of your money worth a lot less. So that's a real risk. There's also a risk in the future of a rise in interest rates. And as Pierre Poilievre, the federal finance critic, asked the finance minister the other day, what would happen if there was just a 1% increase in interest rates? She didn't answer, but Pierre Poilievre, of course, filled us in, that could be up to $10 billion added onto the cost, which is about a quarter of all healthcare spending. So it matters because, if you care about the healthcare system in this country, you should be a fierce advocate for economic growth and making sure we have a robust economy, because let's remember, it's the economy that pays for the quality of living and quality of life that we enjoy today, be it our healthcare system, education, etc. So when we have people saying, we have to shut down the economy in order to take care of our health, well, it's the economy that allows us to have the healthcare system that we have today. So it's very important to make sure that we're not, killing our economy irreparably right now.
Well, I guess this is just it. Is there some limit? I don't know if you have done a calculation. You mentioned Pierre Poilievre. He's been trying to grill the finance minister on creating some kind of fiscal anchor. We used to have one, some kind of rule about what kind of debt we would want to develop. Do you know when we hit the wall? Do you know what the breaking point is? How long can this continue?
So the federal government has refused to provide any sort of fiscal anchor. And what's really scary is that even conservative governments across the country, we see in Ontario just released its budget, which unfortunately was largely overshadowed by American election results. But even a government that was elected, a conservative government that promised that it would balance the budget, now also doesn't have a fiscal anchor. So it's not just the federal Liberals who are known to be, big spenders, it's conservative premiers as well. So this is really scary stuff. But when you ask, how much can we afford? The federal government has hung its hat on this idea that, Canada has the lowest debt to GDP ratio of the G7. And they talk about Canada's strong fiscal position going into this crisis, which may sound like they're being delusional to anyone who's paid attention to their spending. But really and this was in a report released by a bank, one of the Canadian banks very recently, I think it was the National Bank, that said, when you actually look at that number more holistically, the debt to GDP ratio, well, if you only look at the federal government's debt, that's one thing. But when you look at Canada's gross debt, so you add in private sector debt and other government liabilities, really Canada's not doing very well. it's trailing only Japan and France in the G20. So Canada is not in a good fiscal situation. And really what I would remind everyone watching today is that debt today means taxes tomorrow. So when you ask how much we can afford, this is going to be future taxes that we have to pay back. And we already pay, if you look at last year, for example, in 2019, 45% of the average Canadian family's income was already given to the government in taxes. So we already pay a lot in taxes every year. And so the more debt the government racks up now, the higher taxes will have to be in the future. And unfortunately, we're going to be passing down a lot of the reckless spending of today to our children and our grandchildren.
Talk to me a bit more about what you're anticipating on the tax side, because I think, I don't know, my Keynesian economics is a little rusty. I was talking with Troy Lanigan, we're more Hayek people, but if we were to argue the Keynesian side, if you had a universal basic income and you were just giving people $2,000 per month, that has a stimulation effect on the economy. They're going to go out and spend it at the local restaurant. They're going to go out and buy things at the retail shop. They're going to get the money moving, which will allow for the businesses to hire more people back, which will allow governments to generate more tax revenue. Like, why isn't that the answer?
So I think that the biggest falsehood in all of this is that all spending is good spending. Let me be clear, not all spending is the same. So if we look at, for example, Canada, the IMF just released a report. Canada has spent, or at least has the highest deficit this year of all the, I believe, all the G20 countries. So Canada has spent a lot of money compared to its peers as a percentage of its GDP, yet Canada has one of the highest rates of unemployment. So if spending meant that we could stimulate the economy and get people back to work, then Canada should be leading the pack, but instead it's at the back. If we look at some of the other spending, it hasn't been even productive or helpful. One example would be Prime Minister Justin Trudeau and Ontario Premier Doug Ford just gave over $500 million to the Ford Motor Company to retool a plant in Oakville for electric vehicle production. Once this plant is retooled, they'll lay off 400 workers. So in effect, the government has taken $500 million out of taxpayers' pockets, given it to the 12th largest company on the planet to lay off 400 workers. So that's how well Trudeau's job plan is going right now. So I want to be very clear that, some spending is necessary. We're going through a global pandemic, but not all spending is the same. So when the government, and they've acted almost proud of their spending record, which is crazy. But when, they're spending all of this money, not all of it is productive and helpful, and all of it will have to be repaid eventually. Okay,
I want to pose something to you just because I want to understand how this is going to affect all levels of government. I think we've talked quite a bit about the federal. I think the province has got very similar issues to the federal government as well in generating revenues. I spoke with somebody yesterday about how the changing world of work is really going to potentially hammer municipalities now as well. Most municipalities rely on a solid core of businesses getting commuters to come into work so that they can pay those big property taxes, but Calgary is hollowed out. I'm assuming we're beginning to see the same thing. Toronto, Montreal, Vancouver. If you can do this kind of conference from anywhere, why do we do it from Calgary? Why don't we just do it from the Bahamas? I mean, I think the Bahamas has even proposed that people could go live there for a year if they're able to telecommute. Surely that has a real danger of impacting all three levels of government if people now realize they don't actually need to be fixtured in a particular jurisdiction in order to continue to work. That's going to impact the amount of taxes they're going to be able to get off people, isn't it?
Well, absolutely. And we've seen this at the municipal level, which relies very heavily on property taxes for its revenue sources, but really at all levels of government, municipal, provincial, and federal, all of them have seen their finances just obliterated this year. Their revenues have shrunk massively. But I think the most astonishing part of all of this is that governments have just continued on as if it's business as usual. We've seen taxpayers tighten their belt. We've seen businesses tighten their belts. But we've actually seen some politicians take raises during this massive economic downturn. In Ontario, for example, 9 out of 10 of all of the job losses due to COVID-19 took place outside of the world of government. So this is really scary times, because that means that the taxpayers who are, struggling to uphold this gargantuan kind of bureaucracy, now there's fewer of them actually working to hold up all of this government spending. So at the Taxpayers Federation, we've been calling on municipalities to cut the fat. Thankfully, my colleague Franco Terrazzano just called on the Calgary mayor to give up his second pension and was successful in doing so. But we just see a growing divide between the realities for people working outside of government and people working in government. All of the federal MPs took a raise this year. As the Taxpayers Federation, we were calling on them, after they had already taken it, to donate that to charity, and some of them did. But I think that this is a big problem, that governments are just not tightening their belts. They operate kind of in their own world, outside of economic realities.
Jasmine, thanks for that. I should just mention, if you're on Zoom, and I took a look at it as well, there's a couple of little toggles at the top there. If you want to monitor the chat, you can do the chat. There's also a question. If you want to ask a question, you can do that. Troy Lanigan is on standby, monitoring for any questions that have come in. I've tried to do the full range across medical, legal, and economic issues. We'll have a further session this afternoon on economics. But if you've got a question that I haven't asked that needs to be asked, send it to Troy Lanigan, and he'll wave at me if something comes up that he wants to put in. But let me put one more question to the panel. We'll see if we can get each of you to comment on it quickly, and then we'll see if we can take some of the questions. So Frank Luntz, who is normally a fellow traveler in conservative circles, just tweeted this out about an hour ago after it was declared that Joe Biden has won the presidency. COVID cost Trump the presidency, but it wasn't inevitable. The White House could have used COVID as an opportunity to unite a nation in crisis and address the pandemic with the urgency it needed. Instead, they repeatedly played it down. Americans disagreed with that assessment. So let me start with the doc. So Dr. Zitmer, I don't know, it seems to me that politicians are taking it very seriously. Most of the action is taking place at the municipal and the provincial, or in the case of the U.S., the state level. Like, what more could be done?
I think with regard to Donald Trump, he appeared to be totally casual about it. He disagreed with experts, but he had no reason to disagree that he specified. He chose a set of people who became not credible in the public's mind. And there never was a discussion about what information to use. The other thing that I think may have harmed him quite a lot is that it seemed as if COVID was far more prevalent in Republican states that didn't take on any measures to deal with COVID. Now, whether there were rational methods or not to do it, and whether it was a statistical anomaly, I think those kinds of things do influence the public.
I would put New York on the table as the alternative. They have the absolute worst case in America, mostly caused by Cuomo, allowing people who were COVID positive to go from hospitals into nursing homes, and they had a massive number of people die in nursing homes. So that might just be the other counterbalance that the Democrats didn't necessarily do the right thing either.
In Nova Scotia, we had an issue related to nursing homes as well. And I think that was local administration, but
yeah. So tell me then.
I think there's also the perception that's important.
So, but tell me, if Donald Trump could have united the nation with the one or two policies that everyone would agree with, what do you think those would have been?
I think, first of all, he should have acknowledged that it's a serious problem. And I don't think he should have appeared to be as casual as he was about it. Secondly, probably Biden's notion that people should wear masks at least gave the impression that he took it seriously and was trying to do something. Whether it's the right thing or not to do in all cases is separate from, as I understand your question, it's what could he have done to be elected and not have COVID harm him? And I think there are some things that he could have done.
Dr. Zitmer, thanks for that. Let me go to John, because he and I are probably both breaking out in hives at the idea that you just do things for the purpose of getting elected, even whether or not they're going to be effective. I guess, John, maybe this is what I would take from the US election, is that half the population are prepared to assess their own level of risk, agree that it's less, and get back to their normal lives, and half the population want more restrictions. So how do you create a single policy if that's the case? I mean, you can't have a national lockdown. You can't have a national mask mandate if you've got that kind of polarization. What do you think the solution is?
Well, I don't think you can come up with one approach that's going to make everybody happy. We've got, disagreements about the facts. We have disagreements about the severity of the virus, although I think the facts now show that it is not anywhere close to the fear-mongering projections that we had in March and April. I think Trump took a middle-of-the-road approach. It wasn't a completely laissez-faire Swedish approach. He did do some things, but didn't do as much as what other people wanted. But apart from how Trump's handling of COVID may have cost him the presidency or not, I would say in Canada we are long past the point of having a factual evidentiary basis for justifying these continued restrictions. When you look at the data, even on something recent like the hospitalizations and these so-called cases, well, the deaths are still way down. They peaked in April and May. There is not a second wave of COVID deaths, and that's not my opinion. That's what the government data tells us. So I think in Canada we're long past the point of having a sufficient factual basis for continuing with lockdown measures.
All right, Jasmine, you're communications director for the Canadian Taxpayers Federation. If you were Kayleigh McEnany giving advice to the U.S. president, what was there any one policy or one or two policy that could have united everyone?
So I don't necessarily want to weigh in on why he lost, but I would say that I don't want to give into this false binary that it's either about the economy or health. Driving to work every day, technically you put yourself at a risk of a car accident as well. So there's no such thing as this false binary about choosing between the economy. We know a lot more about the virus now than we did at the start. But when people like to cite this poll showing that there are people calling for lockdowns, well, there are also polls. There was one recently done by Nanos Research that showed that over 75%, so a clear majority of Canadians, are concerned about the deficit, as they should be. In just this year alone, Justin Trudeau has added over $10,000 to each individual share of the federal debt, man, woman, and child. So, that's $40,000 for a family of four. So I think that there's probably some sort of safe middle ground between saying, let's not shut down the economy. Like I'm not going to weigh in on health policy, but just to say, there is probably a smart middle ground there that doesn't give politicians a free ticket to endless spending. All
right, thanks for that, Jasmine. I think Troy Lanigan has either some comments to read that are coming in from you or some questions to put to our panelists. Troy, take it away.
Thanks, Danielle. I'm monitoring the chat. I'm monitoring the questions. A couple of things that come up. First, on the medical side, can someone speak to the news that a lot of the tests and the number of COVID cases are have high false positive rates? So that's, I guess, for Dr. Zitner. And also the question that came up earlier too is, if COVID mutates, how is it that we can continue to do testing in the way we do, and how do we find a vaccine in the case of it mutating? On the legal side, a number of people have asked for John to comment on Bill 218 in Ontario, which blocks the legality of any lawsuits over COVID. And obviously, as other people chimed in on that, because of the damage to business, the lack of access to healthcare, those sorts of things. And I think a general question, if I could, just sort of picking pieces up of what I'm reading here, what's happened broadly to the whole concept or idea of personal responsibility, whether it's in your homes or people being able to manage this stuff sensibly in a way that just simply doesn't involve or need or necessitate the state in the way we've seen so far.
All right, maybe we should start off then with Dr. Zitner on the issue of the PCR tests, because I think I understand that a little bit as well about why it's causing problems, and just know that this is mainstream media stuff. It's like stories in the BBC, stories in the New York Times. So we live in the mainstream here. So this is not conspiratorial stuff. Go ahead, Dr. Zitner.
The data that I just looked at suggests that when you have a positive test, 95% of the time you do have the condition. But if you consider that most people don't have the condition, so even a 5% false positive rate gives you a lot of people who have false positives. If the test is negative, the specificity, there's a much better chance that you don't have the disease.
Let me just elaborate on some of the concerns, though, Dr. Zitner, is that BBC and New York Times have commented that PCR testing came about as a way of taking a tiny amount of genetic material in forensics and amplifying it through multiple cycles so that you could find a criminal. And so I think that the criticism that they've said is that the part of the problem is that if you're going to use this test in this case, it can't really distinguish between a live virus that could infect somebody versus a dead virus that has already been destroyed by your body. And that's, I think, why people are questioning whether the PCR tests are the right one to be using and whether it's overinflating the case numbers.
Well, given that there are 5% false positives, you definitely would get an increase in case numbers. Mike Noble, who was the head of the labs at UBC, he remarked that the effectiveness, the predictive value of a test depends not only on the test, but also on which labs are doing it. And not every lab is the same. So you have to learn about the characteristics of the tests. The more important, or the equally important question, I think, is that we need to track what happens to people who have a positive test. So the numbers of tests don't really matter. And given that a lot of people who have the disease aren't really sick with it, we need to know the characteristics of the people who it's most important to predict. It's unbelievable to me that government can't answer John's questions, despite the fact that we spend billions on the Canadian Institute for Health Information.
Exactly. Let's talk a bit about the vaccine. I've already mentioned that I've interviewed somebody about the issues of the vaccines having to be cooled to a temperature that's going to be difficult to transport and be shelf stable. But you've mentioned as well the issues of it may turn out that it needs to be an annual vaccination, just like influenza, because it's mutating. But what is the likelihood of us getting an effective vaccine anyway? And what is the likelihood of us, what is the time horizon we should be looking at? What's your sense of that?
I'm not sure. I know this, that with regard to flu vaccine, if you ask doctors, including epidemiologists, whether they want to get a flu vaccine, about half more or less say they'll get it, half more or less say they won't. Most say that, many say that we really don't have an answer. There's some systematic reviews on the flu vaccine, and it's not clear which groups benefit the most from it. By the way, this isn't to say I'm against vaccines. This is a discussion only for flu vaccine, because what happens is people sometimes take the discussion about flu vaccine and apply it to other vaccines, which we know have a major benefit for the community, and which people should definitely take.
I guess the question would be is if it was so easy to develop a vaccine for a coronavirus, and we've had other types of coronaviruses, why don't we have one already?
I guess people haven't invested enough money in doing it. Or maybe it's not possible. Jasmine, I'm not asking government to develop a coronavirus vaccine.
Thank you, David.
But if it were likely to be profitable, people would do it. It's not easy to do. You've heard many commentators, including expert virologists and epidemiologists, speak about how difficult it is to create a vaccine for something like this.
I think that's important for us to understand that as a baseline, because I do know that there is a group out there that says, let's just wait for a vaccine. So I think that's a nice reality check for us. Let's go to John Carpay to tell us a little bit more about 218. I was under the impression it was to shield long-term care facilities, where we've seen the largest number of deaths. In Quebec, I gather it's 80%. In Alberta, I think it's somewhere around 72% of the deaths have been in long-term care. I thought it was just to shield them from lawsuits. Is it broader than that?
I have not thoroughly researched Bill 218, but I think we need to be wary and cautious whenever governments legislate away our right to sue. So that's kind of as a starting point. The thing is, if you were to try to sue somebody because your grandmother or some loved one died of COVID, it'd be pretty hard to prove your case in any event. But when governments step in to disallow that, I think it's almost like there's an underlying attitude underneath it that COVID is somehow not that deadly, that seems to contradict all the lockdown measures. When I look at Bill 218, it seems to be a departure from the generalized fear-mongering that we've been having for the last 8 months.
Can you just comment on another aspect of that, though? I don't know that we want to get into a world where anyone could be sued because they pass on a cold or flu to somebody. So I'm with you on that one. But what if some of the deaths, or a large number of the deaths, turned out because of negligence as a result of improper staffing in those facilities? Is that something that government can shield those facilities from any kind of legal liability?
Well, and government has done that with, again, I'm not an expert on 218, but the parts of it that I'm familiar with, there is still a window open for gross negligence, so extreme negligence, severe negligence, or sort of over-the-top recklessness that has contributed to the spread of COVID, that's caused death or perhaps long-term medical harm. That the door is open for those lawsuits, but otherwise, the government's kind of saying, look, if the businesses are making an honest attempt to do the best they can, then they cannot be sued. That seems to be the gist of it.
All right. With their personal responsibility. Oh, do you want to comment on this, Dr. Zitmer, before I go to the last one?
Yeah, in long-term care organizations, there's some evidence that if you keep relatives out, you lose the extra eyes. And there's some suggestion that you have an increased number of deaths just because you don't have friends and family coming in and providing the free monitoring that friends and family provide. Not that we recruit them to be part of the healthcare team, but in effect, they are part of the healthcare team.
I agree.
That's a good way of putting it, because if we talk about this last question of with our personal responsibility and responsibility for taking care of your own family members, I mean, some people accuse me of being cavalier about this too, but I'm not. Like, I own a restaurant, so I wear a mask every time I serve customers. I have my cohort. It's only 13 people. Whenever I go to events, I elbow bump. Just ask John and Troy. I elbow bumped them when I came in here today. I'm militant about making sure my hands are washed. So that's how I believe I can best protect the people around me. Jasmine, why isn't that enough?
Well, I think that, personal responsibility is a huge question right now. And for everyone watching the, production today, I think they'll all be really concerned about, there are increasing calls from some elements in society saying this pandemic has only shown the increased need for government. But the Macdonald-Laurier Institute showed that in 2019, the government, their spending already accounted for 44% of GDP. Now, the debt is going to go over $1 trillion this year. The deficit has increased by 900%. So I think that people in this community really have a big fight ahead of us to fight for more personal responsibility and less reliance on government, because here's how much faith I have in the government. They lose money when they run Tim Hortons franchises, which should normally be tickets to print money. In Ontario, they lost $42 million trying to sell pot, which every pothead at my high school could do successfully and turn a profit. That's how much faith I have in government. So these calls for increased government economic intervention should really be fought against hard.
Well, it's too bad we don't have audience interaction. You're cracking us up here, Jasmine. Let me put that same, go in reverse order, same question to John Carpay. What about personal responsibility? And extend that maybe to talk what Dr. Zitmer was talking about as well, is what's our responsibility to care for those who are vulnerable in our own social circles?
I think that hits the nail on the head. You know, people are arguing that we should give up our human rights and dignity and fundamental freedoms in order to save grandma. And my response is protect grandma. Refrain from visiting her in person, see her only by Zoom or Skype, or if you're going to see her outdoors or only in a well-ventilated place or while wearing a mask, et cetera, et cetera. I think it's ridiculous to hear Jason Kenney tell us that we shouldn't interact with each other at social gatherings because, you know, that could kill grandma. When the truth is, if you want to protect grandma, then actually do so by staying 6 feet away from her or not seeing her in person or putting on your gloves and mask, et cetera, et cetera. So that's where what we should be doing is protecting the vulnerable in a real life way without telling, you know, people that are perfectly healthy and perfectly safe from the virus that they cannot freely interact with each other.
Dr. Zitner, I'll get you to answer that same question, but let me just ask you to add a little twist to it, because I hear from our families who have residents in long-term care how devastating it is for them not to have personal interaction, the deterioration in their condition because they can't see their loved ones or hold them or hug them. And so I appreciate that's the only way to avoid having a high death rate, but boy, like they're feeling like their lives are being sacrificed as well because they're not living a full life. How do we answer that?
Well, the question is that the only way to avoid a high death rate? The question is, if people go into long-term care organizations and wash their hands and wear masks, and if testing were widely available and were known to be COVID-free, there probably would be fewer deaths if people were able to go into the long-term care organizations and help. But with regard to individual responsibility, even among my friends, some of whom are in healthcare, the estimates of the risks of doing certain things, there's huge variation. And in the absence of proper information, I'm not sure how people can make that assessment for their own lives. And one of the other issues is that a lot of the information is available in the medical literature, but much of it is hidden by paywalls. If you're part of a university or part of an academic organization, you have access to all of the world's information. If you're a normal person in the public paying for our access to information, you don't have the same access. So I think that makes it very difficult to even decide when you have two people who you think are sophisticated, smart, knowledgeable, interested, well-meaning, and they have two totally opposite conclusions. How do you mediate between it without some data?
Yeah, it's a great point. I should just mention, I served some tables a few weeks ago. I had a 98-year-old customer. So everybody makes their own assessment of their own level of risk, even in the environment we're in. I'm about to get the hook. I'm 3 minutes over time. I'd get fired at work if I went this far into news. I'm going to hand it off to Troy Lanigan. We'll see you this afternoon.